It was really hard when the hospital got a hold of me and said, hey, can you do a doctor's orders on the early signs of dementia? And I was like, really? I've only spent 18 years studying it, and I'm not sure if I know all the early signs. So I'm hoping that by the end of today, we can talk a little bit about what dementia is, but then we can also maybe talk a little bit about one form of dementia that's a pretty common one that most people are concerned about when they come in to my clinic. Really quick, so that you know, in my profession, we're required to let everyone know where our money comes from. While I am medical staff here at Davis Hospital, they do not pay me for my services. I'm actually contracted with them. I have my own private clinic here in Layton, where I see patients, but I do come into the hospital and do evaluations for them when they need it. So let's hop right into it. What is dementia? Right? Because that's always the question that someone comes into me and asks, says, I think I have dementia. Well, that can be really hard because at times we think, well, if I'm struggling, if I can't remember where I put my flash drive, maybe I've got dementia, right? Fun experience I was sharing earlier, my dad called me about 6 months ago and he said, I think I have dementia. And I said, okay, what makes you think you have dementia? I was at work and I looked at my receptionist and I've known her for like 5, 6 years and I couldn't remember her name. And I was like, okay, Dad, I just spent Saturday with you and you're fine. But he's like, no, I couldn't remember her name. It took me like 20 minutes to remember it. And I'm like, that's actually normal. Because if it was that you forgot a name, my mom probably had dementia when I was 10 because she called me by all 5 of my sister's names before she ever remembered my name. Right? And I love her to death, but let's be honest, there's moments that we sometimes forget a couple things. And that can be sometimes very, very scary. But that doesn't necessarily mean that we're really having the problems we think we have. So I'm hoping as we kind of go through and talk about what really is dementia and those type of things, you'll maybe be able to better understand some of the things that, at least for myself as a clinician, I'm more concerned about. So like it says, it's a general term that just means that, hey, our brain's slowing down, it's starting to have problems. And the big issue isn't that it slows down, because with age that happens. By the time you're 24, 25, your brain is at its peak capacity. That's all that you're going to be able to fully do. Now I know some of you with 24-year-old kids are like, really? I was kind of hoping for more, right? But the reality is, at least in the development of our brain, how it wires itself together right about the age of 25 is about where it tops out. So you may learn to understand rocket science, but you're not going to be a rocket scientist at 60. It just doesn't work that way. So as we start slowing down, that's normal. Where we get concerned is when you start slowing down outside of what we expect for individuals your age. If you look at the current research, about 10% of our cognitive ability by the age of 70 is gone. That doesn't mean